Hi, I'm Dr. Jeannie Knapp. I'm a GP working in Richmond and the GP advisor for Northwestern Melbourne Primary Health Network. I'm here to talk to you today about the Northwest COVID positive pathway and what you need to know if you are notified that one of your patients is enrolled in it. The COVID positive pathway is designed to provide safe, high quality and community-based care for low-risk COVID positive patients. Patients can be escalated to higher levels of care if required. Patients who test positive to COVID in the Northwest region are assessed by an experienced clinical team at CoHealth, a local community health service. This clinical assessment determines each patient's risk of becoming unwell. Patients who are determined to be at low risk will be enrolled in the low risk care pathway, with their permission, of course. These patients can then be cared for by their usual GP, who understands their patient's health and social history. These patients will be asked who their usual GP or usual general practice is. If the patient doesn't have a usual GP, the PHN will work with CoHealth to find a suitable doctor. CoHealth will then notify the practice or GP about their COVID patient. This handover will be by phone and in writing. As the patient's GP, there are some key things you need to do once you take on a patient in the pathway. These are in place to support your patient while they have COVID and make sure the local hospital and public health unit are receiving your updates about your patient's clinical condition. First, you must connect with your patient regularly to ensure they are well and that their condition is not deteriorating. As part of the handover, you will be notified of the date on which your patient tested positive. We strongly recommend calling your patient immediately to establish their care plan. Once you have established contact, the suggested schedule is a call every third day during days 1 to 4 and every second day from day 5 of their illness. You will receive an email or text reminder, depending on your preference, when a call is due for your patient. During each of these calls, it is good practice to assess the patient's symptoms, particularly shortness of breath, and if they have deteriorated in the days since you last spoke. This assessment will allow you to develop an appropriate care plan. After each call and assessment, you will be asked to complete a symptom monitoring survey using the online REDCap system. Completing this survey is essential for clinical communication with the public health unit about how your patient is progressing and if there are any signs of deterioration. You will receive these symptom monitoring surveys by email or SMS. If you do not complete a survey, the PHN will contact you to ask you to complete it. Patients can deteriorate quickly. We need to be absolutely sure that each patient is being monitored and getting the right clinical care. If at any stage your patient is deteriorating or you are concerned about their health, there are supports in place for you to get the patient the help they need. The details for escalating patients are available in the pathway documentation and on Health Pathways Melbourne. GPs will complete a REDCap form that confirms the patient has met discharge criteria. GPs can discharge patients from the model. However, release from isolation, i.e. clearance, is by the Western Public Health Unit. Clearance is generally given no sooner than day 14 if symptoms are resolved by day 12 and no later than day 21. REDCap will send a notification to the Western Public Health Unit for review and a clearance assessment. They will contact your patient if they are cleared and inform them of their clearance statement. Your patient must continue to comply with isolation requirements until this point. Your general practice can then resume usual care of the patient. It's good practice to check with your patients 2 to 4 weeks after the intensive period, as there may be ongoing issues. Up to 30% of patients who are infected with COVID-19 will go on to experience long COVID symptoms. Long COVID can cause serious issues for weeks and months to come, regardless of the severity of the initial illness. Please refer to our website or Health Pathways Melbourne for clinical guidance and referral options to support your patients after COVID. If you need more information or support, please contact the team at Northwestern Melbourne Primary Health Network. If you have any feedback about the pathway, how it's working for your patients, or suggestions to improve it, please let us know. We will make sure your voice is heard by the Victorian Department of Health, the hospitals, public health units and CoHealth. For information about other COVID positive pathways active in Victoria, please visit our website or Health Pathways Melbourne. Thank you for being involved in the Northwest COVID positive pathway.